An opioid overdose can be reversed by administering the opioid overdose reversal medication naloxone. There are several brands of nasal naloxone, but many people know naloxone by one brand's name, Narcan. If you witness an overdose or suspected overdose, you can help. Studies have shown that community members can respond to opioid overdoses with naloxone and save lives. We're going to share 6 critical steps to follow. Step 1. Know the signs of overdose. There are some basic physical signs to look for when you suspect someone might be overdosing. 1. The person is unconscious and cannot be woken. 2. The person is not breathing or breathing very slowly with little to no chest movements or with long pauses between breaths. 3. Shallow or depleted breathing, sometimes making a gurgling or snoring type sound. 4. Blue or grayish skin color around the lips, inside of mouth, eyes, and fingernails. Step 2. Check for response. If you suspect an overdose, before entering the person's space, touch foot to foot to make sure they are not sleeping. Shake the person and with a loud voice say, "Are you okay?" If you do not give me a sign that you are okay, I am going to call 911 and give you naloxone. If the person doesn't respond, try to lay them on the ground, flat on their back. Then, make a fist and place it on their sternum. That's the bone that runs up the center of their chest. And using your knuckles, move up and down on the sternum. Check for breathing by looking, listening, and feeling. Step 3. If the person is still unresponsive, call 911 immediately. Set the phone to speaker so you can tend to the person while talking to the 911 operator. It's important to call 911 before administering overdose reversal medication because even if the medication works and the person starts breathing again or wakes up, it's possible they have other drugs in their system that could hurt them. Also, the opioid overdose reversal effects of naloxone may last only 30 to 90 minutes. Law enforcement may be the first uniformed responders to arrive on the scene after a 911 call. Oregon has a Good Samaritan law in place so that if someone is experiencing an overdose and you seek medical help for them, neither of you can be arrested or prosecuted for having drugs or drug paraphernalia or being in a place where drugs are used. Step 4. Give 1 dose of naloxone. Tell the person loudly, "I am going to give you naloxone." Place your thumb on the plunger and your index and middle fingers on each side of the spray nozzle. Do not test or prime the plunger. It will dispense a single dose of naloxone and cannot be reused. Insert the nozzle into the nose and push the plunger firmly to release the spray into the nasal cavity. Check again for breathing by looking, listening, and feeling. As long as the person starts breathing on their own, don't worry if they don't wake up. The goal of giving naloxone is to restore breathing. If the person does wake up, they will likely seem groggy, like they are waking up from deep sleep. They may also be confused or disoriented. Your role is to remain calm and, using a soothing voice, let them know that you just administered naloxone to them because you suspected they were having an overdose. Try not to let them get up and move their body into the recovery position, which we will describe later in Step 6. But if the person does not start breathing within a few seconds after receiving the first dose of naloxone, it is critical for you to prepare to and then start to breathe for them. Step 5. Start rescue breathing if needed. A person who is not breathing is not getting oxygen to their brain and organs. Rescue breathing buys time for the naloxone to work, for the person to start breathing on their own, and for medical first responders to arrive. To give rescue breathing, start by making sure the person is flat on their back. Once the person is positioned, open their mouth and check their airway for any foreign objects or obstructions. If you have a respiratory barrier or rescue breathing mask, take it out and place it between your mouth and the individual's. A respiratory barrier or mask is not required for rescue breathing, but if you have one, you can use it. Then, Tilt forehead back, lift chin, pinch nose, and give normal breath every 5 seconds for 3 minutes. You want to blow enough air into their lungs so you can see their chest rise and fall. If the person is still not breathing on their own after 3 minutes, give a second dose of naloxone. Recheck breathing, and if the person is still not breathing, restart the cycle. Rescue breathing is tiring, so if there is more than one person who can help, take turns giving rescue breathing. Step 6. Put in recovery position and wait for first responders. After the naloxone takes effect, whether the person wakes up or is still unconscious but breathing, position the person's body in the recovery position. This is critical for ensuring the person does not choke, and it allows them to keep their airway clear until help can arrive. To put a person into the recovery position, roll the person over slightly onto their side. Take the arm on the ground and place it out in front of the individual. Tuck the hand of the top arm under the head to support the head as it lies on the ground. Bend the top knee and put it out in front of the person to prevent them from rolling onto their stomach. Finally, when first responders arrive, tell them that naloxone has been given. Naloxone is widely available across Oregon, and there are a few ways to get it. 1. Anyone can enter a pharmacy and buy naloxone without a prescription. Retail price is less than $50 for a box that contains 2 naloxone doses. 2. If naloxone is prescribed to you, you can use health insurance, including Oregon Health Plan, to cover or help pay for the cost. In Oregon, pharmacists can prescribe and dispense naloxone. Copays and other fees vary from pharmacy to pharmacy. 3. Veterans enrolled in VA healthcare can get naloxone for free from a VA pharmacy with a prescription from a VA provider. If you or someone you know is struggling with substance use, call the Alcohol and Drug Helpline. For more information on naloxone in Oregon, scan the QR code or visit OHA's website. You can also learn more about opioid overdose reversal medication and other harm reduction tools by visiting SaveLivesOregon.org or the National Harm Reduction Coalition website at harmreduction.org.